and Sass. The series talking all things skin with a side of sass. Hosted by Kelly George and Andy Paulson. Proudly sponsored by KGA Body. Hello everybody and welcome to Skin and Sass TV. I'm Andy Paulson.
And I'm Kelly George and this is Vampires Live Forever.
Did we intend
Was
on
that
saying
cheesy?
that together?
No.
I don't know. So Vampires Live Forever, otherwise known as a vampire facial, which we cannot say because it's trademarked. So from here on in, we will be referring to it as microneedling with PRP, which is really what it is.
It's really what it is, and actually, medically speaking, we tend to call it collagen induction therapy, which I think is a much nicer word. But that's what we're doing. We're producing or stimulating the synthesis of collagen, which who doesn't want a bit of extra collagen?
That's right. So all the things that keep skin looking youthful and thick and plump and hydrated, that can decrease with age, unfortunately.
Honestly, microneedling with PRP is still to this day one of my favourite treatments for overall rejuvenation, because it just takes off that top layer of dead skin. It's really good for a little bit of pigment, a little bit of sun damage.
Yes.
And then of course it produces that new collagen, so you get this nice plump. You know, you can't go past it really.
And let's remind people what PRP stands for.
PRP stands for platelet-rich plasma. So you will find, if you're sort of researching microneedling, that some, I guess, more beauty salons will do it without the PRP.
Right.
Because obviously they don't have the qualifications to take your blood and spin it down, things like that. But here at KGA, we only do it with PRP because the science suggests that it is much better. They've done a lot of split face studies where one side they do with just like a hyaluronic acid, the other side they do with PRP. And all of the clinical trials prove that the PRP side is significantly better in terms of the collagen production.
Right.
So while both options will resurface because of the little holes that it will put in the skin, if you really want that collagen production, so anyone over the age of 30, you want to seek out a place that does it with the PRP.
Yeah, so in terms of bang for your buck, microneedling, you will see an improvement in skin tone and texture and pore size.
Yes.
But really for bang for your buck, less treatments, better outcome combining it with the PRP.
Absolutely. I mean, look, there's a little bit of data out there that sort of says, and it's not a big study, but you might need around about 12 sessions without the PRP to 3 sessions with PRP. So considering the fact that you do have a couple of days of downtime in terms of your face will be red and a little bit flaky, 3 times is a much better.
So much better. Yeah. So much better. And I've never had a vampire facial.
Yeah, that's crazy. I honestly thought you had
PRP, but I haven't had the microneedling all over the face.
Okay, well, we should do that for you as well.
Well, we are here at KGA today, and we are going to see some footage, right?
We are. We do have
having
some,
a vampire or microneedling with PRP. Sorry. So I
don't want to get sued.
I don't want to get sued. Don't sue me. Microneedling with PRP.
Yeah.
So, and we have spoken about, I did ask you this while we were chatting about the apps. We did last season do an episode on skin boosters, which is a bit different to microneedling. And the way that you explained it to me, Kelly, with the skin boosters is that it's more superficial. So the needles are closer to the surface.
With the vampire.
I've done it the wrong way around.
So with the medical microneedling, obviously it's tiny little needles on the end of something that looks like a pen, and we roll it over the face.
Yes.
So it's putting thousands and thousands of microchannels all through the skin. With the skin booster, the skin boosting gun, which we showed you last season, it's got 9 needles and we inject it straight in. So we're not going over, we're not doubling up on tissue, but it is injecting straight into a deeper layer of the skin.
Right.
But we're also doing a little bit of dermal filler within the concoction. So there's PRP plus dermal filler, which not everybody needs. You know, it's definitely more for an older patient versus anyone can have microneedling, particularly young people who have got a bit of congestion, who have got a bit of acne or acne scarring. A vampire facial, which I've just said it again, is
microneedling with PRP. But acne scarring is a big one, right? Because, you know, like for people I know, like friends that have acne scarring, and like laser is an option, but this is a really great option as well.
In my experience, combining it with laser is always going to be the best thing for deep pitted scars.
Yes.
But if you've just got a little bit of, I guess, textural problems from a little bit of acne, Microneedling, 3 sessions of them, roughly a month apart, will clean it up beautifully.
Okay.
Yeah.
So should we show people what
Yeah.
it looks like now?
We should. Just like the treatment we showed you in last season for skin boosters, the patient's face is cleansed and we apply numbing cream for around 10 to 15 minutes. While the patient is numbing, we take a small amount of blood and get it in the centrifuge so we can spin it down to extract the platelet-rich plasma. Once the patient is numb, we have our syringes of PRP ready to go and we can commence the treatment. Okay, so after the patient is cleansed, we've taken all the numbing cream off, what we're doing now is just applying a little bit of the serum so that the needle slides a little bit more easily. Now, Soph's obviously set the needling device to a specific depth based on the fact that this patient has a little bit of pigmentation, so we don't want to go too deep. So you can see that we're going to apply the PRP as we're using the needling device. And if you look at the patient's skin, you can see that she's just a tiny little bit pink. There's no actual visible blood, which is the exact endpoint that we're looking for. You've probably seen on social media, you've probably seen with Kim Kardashian that people go in and they have vampire facials or microneedling and they look all bloody and like they've been in a horror movie. That is not the desired endpoint. That's in fact too much trauma. So really when you leave after having microneedling with PRP, you should just be a little bit pink. Now we try and get as close to the eye as possible because we want to treat the crepey skin around the eye area. But of course, depending on whether or not the patient has a lot of skin laxity through there or a lot of crepiness through there, sometimes we can go that extra step and actually do the PRP injections through the under eye area. But today, obviously she's young, she's got pretty good skin other than a little bit of pigment that we're hoping to treat today. So we don't really need to do that extra step. Okay, so we've moved on to this side, but as you can see, this side is still just nice and pink. There's no blood showing. This is exactly what we'll be looking for at the end point, and this is what the patient will leave like. She won't look any redder. She won't get any redder throughout the next day or so. Okay, so this is the exact endpoint that we're hoping for. She's a little bit pink, but there's no actual blood showing. Now, again, we spoke about before, this particular patient has a little bit of pigmentation, so what we send the patient home with on their face depends on their specific skin concern. So we're going to use a product that will help break up the pigmentation because we've created those microchannels in the skin. Sometimes it does tingle a little bit for the patient, so we chat to the patient about how they're feeling to make sure they're not too uncomfortable. But if it does tingle, it's only for a minute or two. We then seal everything in with something called BioShield, which creates a nice barrier for the skin because we have broken that barrier function down for a few days with those microchannels. And we tell the patient just to not touch their face for the next 6 to 8 hours. If it's late in the day and they've had the treatment, we tell them just to sleep like that. And of course, we don't let them leave here without sunscreen.
Really great to see, Kelly. And so what is the downtime and what's post-care for after having a microneedling with PRP treatment?
Yeah, so as you saw with that patient, she was just a light shade of pink, and that's typical. Occasionally you'll get a patient who goes a little bit redder than that, and occasionally you'll get a patient that doesn't look like they've had anything done at all. But typically a light shade of pink for about 2 days. Third and fourth day, they might be a little bit flaky, but it's not appealing. So it's something that you can definitely go out and about it on your day. Most of our patients like to do it on a Friday and they're perfectly fine for work by the Monday. In terms of the post-care, we do definitely like you to put really great things on your skin. We definitely say the Age Intervention Peptide Extreme by Gianmarini, which we've spoken about on here a lot, because it's full of peptides and antioxidants and I guess ingredients that will help heal the skin. We have put holes all through the skin. So we've broken down that skin's barrier, which means our barrier function is not there, meaning anything that we put on our skin for the next 48 to 72 hours will absorb about 80% more than what it normally would because we don't have that barrier function.
Is that a good opportunity to use actives?
It's an amazing opportunity to use actives.
Yes.
Absolutely. I mean, I lather the actives on. And in fact, I spoke earlier about the clinical studies, and one of those clinical studies actually proved that using vitamin C
Yes.
afterwards actually significantly enhances your results. So, if you've got a patient who's already on actives, you don't want to throw too many in there if they're not already a big actives user. But if they're already using really good skin stuff, I tell them just to ramp it up. We use the peptide 3 times a day for 3 days.
Oh, wow.
And we use the vitamin C.
Okay. And in terms of makeup, would it be best to avoid makeup?
No makeup for two full days.
2 full days.
Because that barrier is gone. So, while you've got this great benefit of being able to put really good ingredients on, you want to avoid
Steer
anything.
clear of makeup.
Yeah, we don't even say even your basic things like a sorbeline, nothing like that. You have to either use really great actives or just a rosehip oil or a straight hyaluronic acid that we'll give you a little tube of if you've got nothing else at home.
Yeah. And how much is one treatment usually of microneedling with PRP?
It ranges across the board, obviously, but usually it's anywhere between 400 and say 550.
Okay. And unlike other treatments, they may only need to get a few. So, and like straight microneedling, they need to get less.
Yeah, look, what we tend to tell our patients is 3 sessions about a month apart and then just 1 or 2 a year to maintain those results.
To maintain the results. Yeah. Oh, that's great.
Yeah.
And so sassy minute time.
She keeps throwing the sassy minutes
I keep throwing them at her. But the OG fans like the sassy minute.
True.
Now, what about for those people out there who see advertised on social media or even at the Priceline or pharmacy at home dermal rollers?
I knew you were going to mention those.
At home, as a cautionary tale, right?
I've told everyone 1,000 times to not use them.
But maybe people are new.
So here's the difference. The dermal rollers roll over the skin, and so as they do it, they're going to create sort of greater channels in the skin. Some of them don't go to a depth that is problematic. Some of them out there are very deep, and so when they're rolling and creating those channels that are stretching, you can actually create infection. Then, of course, there's how you store those dermal rollers.
Chuck it in the bedside drawer
and then
spray it with
do it the next day.
Sanitizer.
So, some of them are at the perfect depth and you will be able to, I guess, use them and apply a little bit of serum and you might get a little bit better absorption and you might get a nice glow. But of course, you've got to remember how you store them. You've got to make sure they're clean.
Yeah.
And you've got to check the depths because there are some being sold out there online that honestly are far too deep and will create far too much trauma for the skin.
That's right. And then when you're not in a sterile clinic environment as well.
I mean, I tend to recommend against it, but
yeah. Okay. So in clinic treatment, guys.
Yeah. But you can't use the PRP, and we just spoke about how much more beneficial it is. So
all right, hook me up with that liquid gold. Thanks everybody for joining us again on Skin and Sass TV. We'll see you next time.
bye.